my name is Vicky, and today's video I'm going to be speaking about multiple sclerosis and pregnancy. So there's so many issues that can come along with multiple sclerosis and pregnancy. Imagine multiple sclerosis and pregnancy at the same time. Even though some people say that it is great and you don't feel any symptoms, that is true. When I was pregnant 12 years ago, I didn't feel too many symptoms. And I was able to go about my life without taking medication. But there are a lot of emotional factors to pregnancy and multiple sclerosis. So them combined can really make things go crazy in your head. But before I get into that, I want to let you know, this channel I speak about multiple sclerosis and multiple issues that can occur with multiple sclerosis in hopes of helping others with research that I've done and to spread the word about what resources are out there. I've just made a video about resources for multiple sclerosis and the Multiple Sclerosis Society. So there's a lot of great things coming, guys, so please subscribe, hit that notification bell, and share and like, and I like to hear your comments, so keep that in mind. Make sure you comment down below. And so let's get started with this video. So I have some information from a doctor. I'm going to say like a pregnant woman. So I wanted to read this to you guys. I'm going to try not to be too boring, but it's information directly from a doctor and research that they've done regarding multiple sclerosis. So it is true, most women that have multiple sclerosis, most, not all, but most of them, they do not feel too many symptoms, too many multiple sclerosis symptoms when they're pregnant, which a lot of people are like, good, let's get pregnant again. But then after the baby's born, then comes the problems most of the time. It's been known or studied. Studies have brought out the fact that most women that deliver 2 months after the delivery, they have a huge exacerbation. And that was my worst exacerbation actually 12 years ago, right after my son was born. So I had him in March. I want to say in May, I could not hold him. I could not give him his bottle. I was just devastated. My body was not working for me. It was horrible. It was the worst time of my life, honestly. So either way, so I didn't know anything about multiple sclerosis and pregnancy. I was 20 years old. It was my first pregnancy, my first and last pregnancy, and I just had been diagnosed less than a year from the time that I was diagnosed with pregnancy. No, but from the time I found out I was pregnant, I had less than 7 months prior to that been diagnosed with multiple sclerosis. So I was really naive about multiple sclerosis and definitely pregnancy. So either way, there's two theories that the doctors state because of some research that they've done with pregnant women who have multiple sclerosis. So the first theory comes from Dr. Sickott, who states that the pregnancy leads to a shift of immune responses because you're carrying a child, a fetus that has a foreign DNA from the father, of course. So your body has to change, your immune system has to change in order for your body not to reject the fetus. So that is one theory. The second theory is that in general, the anti-inflammatory and seemingly neuroprotective power of pregnancy hormones shields you from any symptoms or multiple sclerosis effects that you would have on your body. So a lot of women feel the best when they have multiple sclerosis and they're pregnant because they don't have to take medication. They don't feel the symptoms, whether it be weak legs or any of that. You might feel some of that, but it's not to the extreme like it can be when you're not pregnant. Even though at times there are some women that may experience very bad symptoms. However, it's really unlikely it's what has been shown, and because of the studies that they've done with the Multiple Sclerosis Society and scientists and doctors have done in the past years. In the 1990s, it was shown that their study had grown, and that's when they were focusing on pregnancy and multiple sclerosis to see why they no longer had to, the women no longer had those symptoms, and they felt great. And I want to say that for me, I did feel pretty good, but I did have a lot of emotional problems. I was depressed. I did not know that I was depressed. I was confused. I didn't know. A lot of that is because of uncertainties that I had. I had lack of knowledge about multiple sclerosis and pregnancy at the same time, and then a baby was coming in this world, and I didn't know what I was going to do. So when I was first diagnosed, it's sad to say that I thought of abortion. I'm glad I didn't go through with abortion, and I'm so happy and blessed that I have my 12-year-old child, who he's a pain in the butt sometimes, but I love him. So and I couldn't live without him. I don't know what life would be without him, nor do I want to know. So I'm so glad I chose to have him, despite of all the terror I felt. I was just not feeling it at all. I was so terrified, and like to the extreme. Like I did not know what I was going to do. I was thinking, oh my God, I'm only 20, I'm finished college, I have not, which I know there's women or children that get pregnant, I get it, but I was so scared. I was scared. And then the fact that because of these studies that they've done in the 1990s, they have said that when you have a girl, baby girl, she has a higher chance of being diagnosed with multiple sclerosis than a baby boy. Which I thank God again that I had a baby boy, but at the same time, he's still my son. He still has my DNA, so it still kind of scares me. So I'm like, take your vitamins, take your probiotics. I don't know if they've said in the past, I've spoken to my doctor, she said that maybe probiotics will have some good to do with multiple sclerosis, so they may help him not have the disease. But they don't know, because they don't even know what the disease is yet. They don't know if it comes from the genes, from what you eat, from lack of protein. They've been said that lack of protein. And I know I was anemic whenever I was pregnant. My mom was anemic when she was pregnant. So I don't know where it comes from, like I said, but I was scared. So, but thankfully he is a healthy baby boy. He's not a baby anymore. He is taller than me. But I just want to say, for anyone that really wants to have children, you know what, you never know what's gonna happen anyways. If you want to have a baby when you have multiple sclerosis, honestly, it's not too bad. Other than after you have the baby, it can be really harsh. But if you get with your doctor, maybe they can have a plan for you, so that hopefully you're not a person who has a drastic change, because your hormones change already. So once you're no longer pregnant, so that may have play a factor into you having that relapse after your pregnancy. But when I was pregnant, I didn't take any medication. I didn't take any of anything else other than my vitamins, my prenatal vitamins, that actually I still take. Just because I have more vitamins in those prenatal vitamins. And so I feel like they help my body more. And also I ate the way a pregnant woman ate. I craved pickles, sour pickles. That wasn't good. My legs, they flared up like they were swollen. My face was swollen. Everything was swollen. But I didn't hurt or any of that. I still worked. I worked till the last day of my due date was March the 8th. So on March the 8th, that was my last day of work, even though he didn't come until 2 weeks after my due date. But I was like, you know what, that's my due date. I had already put in for that due date, to stop working. So I went in and took it. I took them 2 extra weeks, and but I could have worked all the way up to my delivery date. Well, that was my delivery date. They induced me. They ended up inducing me just because my body didn't, I did not dilate. You know, I didn't dilate. My water didn't break. None of that. But they also say there's been research that people do have complications. Women have complications that have MS while they're going to deliver, while they're in the process of delivering. So, well, for me, it was they induced me, so they broke my water. I was in labor for like almost 20 hours, it seemed like. So I went in at 6 in the morning to be induced. I didn't have him till 2:45 in the afternoon. It really felt like 20 hours. It wasn't, but oh my God. So it was horrible for me. But so that's another reason why I've decided, like, I'm not having any more kids. And then to raise them, oh my goodness, that's a whole nother story, whole nother topic. But so when they induced me, my son's heart rate went out of control, was skyrocketed. And so then he also defecated on himself, so he pooped in the womb. And then I found out that I had somehow contracted E. coli, and I didn't even know it. So when he defecated inside of my womb, he contracted E. coli. And so he was in the NICU for 2 weeks, and the doctors told me he can be autistic because of how, you know, the infection that he had when he was born. They had needles in his head. They, you know, in the NICU, they were poking him everywhere. They left a rubber band on the bottom of his little foot, his ankle, so that, I'm guessing, so they can help the veins show up. So they tied a rubber band on his foot, and I remember they left it there. His little foot was purple, and they gave him to me. He kept crying, and I didn't know why he was crying. So I unwrapped him from the, you know, they had wrapped him in a cover. So I finally unwrapped him, and I saw that his little foot was purple, and I took the rubber band off, but I was so mad. But anyways, yeah, so he went through a lot in 2 weeks. We stayed in the hospital, UT Southwestern, thank you. They allowed me to stay in a free room. I wasn't, you know, I wasn't in the hospital anymore, but they allowed me to stay in a room so I wouldn't leave my son by himself there, even though they took care of him in the neonatal intensive care. And then after he was out of the intensive care, they took care of him with the nurses and stuff. So they helped me a lot within those 2 weeks. That was really helpful, especially being a new mom. But either way, it was super scary, like super scary. I do not wish that on anyone. So with that being said, there can be some complications, but I have known a lot of people who have multiple sclerosis to not have too many, the babies do not come out with a lot of complications. So I think a lot of that would have to do with me not, my body not, you know, dilating and not being ready to have my baby. So either way, best wishes to everyone who wants to be pregnant or doesn't want to be pregnant. That's your choice. Do your research. There is a lot of research out there. Again, I'm still scared that my son may have multiple sclerosis. But hey, no one in my family, my mom doesn't have multiple sclerosis. You know, my sister, no one has multiple sclerosis. And I was diagnosed when I was 20. So I just said, hey, I'm just gonna pray and keep the faith. So have a wonderful night, and thank you for watching.